Sierra mentioned, so we're going to get right into it, guys. The deadline, that's looming. Anybody that's participating in MACRA or MIPS has a hard deadline of December 31st, okay? And what that deadline means is that your SRA itself needs to be completed. And we'll talk a little bit more specifically about what point in the process you've got to get to qualify there. Now, this is absolutely critical to your filings. Make sure that you are able to participate. Again, it is a requirement that you complete it and attest yes to conducting that security risk assessment. Okay. Again, that risk assessment needs to be done in the calendar year that you will then, in Q1 of next year, submit the filing for. Okay. When we're talking about HIPAA, you've got this security risk assessment. Even if you're not participating in MIPS and MACRA, you do need to get this done and get it done regularly in order to be and remain in compliance with the HIPAA security rule. Within that, right, what does that all mean? You've got to have remediation plans for any things that you identify. You've got to have policies and procedures. You've got to document everything that you're doing, and you've got to know who your partners are that are working with and have access to your data on your patients. And again, then there's breach notification procedures and proper access to PHI. You got to keep it secure, but give it to the right folks when they ask in an appropriate manner, okay? Again, there's a lot there. We're going to unpack a little bit more of this as we go through. And it's not easy. There's lots of stuff on your plate outside of this, okay? But HIPAA is critical just to the regulatory filings, as well as actually taking care of and being a good steward of your patient's information. So a lot of challenges. It does take time amidst everything else that you've got to do and treat patients on top of that. It can be a manual process if you're not using good tools. Everybody in the practice is probably already doing something, or in the organization has another job. And then you've got to do it repeated every year. Okay, and then obviously time that none of us have enough of. But that burden can be eased, right? Software makes a big difference. Something where you can centralize the data, get access to help. As we're talking about with anything, just like getting a second opinion from another doc, you're not a HIPAA expert. Have somebody that you can go to as a resource. And track what you're doing. Again, part of that requirements we just saw on the last slide, when you do the gap assessment that is part of the SRA, you're gonna identify places where you need to improve. You gotta track that. You gotta document that as well as you documented the risk assessment, okay? And again, you need some reporting. You gotta have a report each year to justify and that you're attesting that yes, you did it. One thing to note too, while we're talking about that, it's not just this year, right? You do your SRA this year, it could be something that happens or comes up 3, 4, 5, up to 7 years from now. They can still ask for your 2022 HIPAA SRA and penalize or reprimand accordingly, up to 7 years in arrears. So you also need to keep track of that information. Make sure you have it on hand and you can access that if, knock on wood, something happens in the future. The risk assessments, okay? We're going to talk a lot about security risk assessment because that is the piece that has the really specific requirements to get it done. But these risk assessments are absolutely foundational to being in compliance and ultimately protecting that data. You got to find the gaps before you can do anything. Those gaps are easy places for you to get hacked, breached, or otherwise lose access to the data. The roadmap, that's that remediation plan. Knowing what to do to improve things, you've got to have that map. And you got to keep updated. And then, of course, again, you're at the completion, you're going to be able to qualify for MIPS from that standpoint of HIPAA. Okay. Now, the risk assessment. We're going to talk a little bit about when. We know the deadline's coming up, right? That's the big hard deadline. But there are other times, okay? Obviously, you've got to do it regularly. If you do this now at the end of this year, get it done for 2022, you do not have to wait till December of 23 to do the next one. You could do it in June. You could do it in May. You could do it in January of next year if you really want to do them back to back, and that will qualify for next year's MIPS because it is done in that calendar year. But outside of those requirements, cybersecurity hygiene, right? Performing the SRA does help identify vulnerabilities. It does help protect your patient data that you have. And the big one there at the very bottom, if an incident happens, it could be as easy as getting a laptop stolen, somebody accidentally clicking on the wrong email. If you have an incident, conduct another SRA immediately. When the investigation happens, the first request that is presented from the Office for Civil Rights, who does those investigations into breaches, they are going to ask for your HIPAA Security Risk Assessment. So be ready with that. Be proactive, show that you're doing and taking steps to improve that. And again, I know Sierra mentioned this earlier, but if you do have questions, chime them in. If I can get to them in the flow of the presentation, I definitely will. But happy to jump on and talk through those at the very end as well. Okay. And again, we're moving quick here today, guys, so appreciate you moving with me, but happy to address any questions. All right, so I want to talk about how we can help you guys get your SRA done, and you can start now and still get it done for the MIPS qualification. Okay, sorry, hit that button. We have done a ton of assessments for a lot of different folks, and we've saved you a ton of time, those folks that have used our platform. Okay, that's what we pride ourselves in. We try to make the complex simple and move you through in an organized and automated way. So the software, and this is the big key, and I'm going to talk about this in a few different steps as we go through how we do the risk assessment and how we help. And we'll talk a little bit specifically about how you can do this and get it done in a very short time frame and move through that way. Okay, so let's talk about step one, and that's gathering. You got to get information together. Okay, when you're doing an SRA, you've got questions you have to answer. Those questions are inviting you to document what you're doing in the HR area, a couple different areas in network and server in the IT world, what you're doing with your facilities, and then just the general HIPAA security, how you're managing that. Okay, excuse me. It's critical as well that you look at the locations that you have. If you have more than one, are those things being applied outside of the main location? Likewise, you may have an EMR, but you could have a separate PM or a PAC system or a patient communication system, a Phreesia type, patient kiosk system. Any of those that handle PHI from your patients, you need to make sure that they're following the HIPAA guidelines, that they're secure, that you're managing them appropriately. Okay. So in this gathering phase, you can see this is a screenshot from our platform. We divide it up, allow you to, if your practice or your organization works this way, you can delegate, have other folks participate in gathering this information. Get an HR person to get you the HR policies. Get an IT person to get you the network information. However, we work with lots of small practices too. It could be one person doing all of these, but to the extent it works, delegate out. It's faster, it's efficient, you get the right information in, okay? Each question has the same look and feel, all right? We're not trying to reinvent the wheel each time. We want it to be simple and quick. The gray box on the right, that's the actual HIPAA regulation text, its citation, what it's covering. In the white, that's where we're gonna focus you, right? Because we've translated all that regulatory language into a very simple question. You can read here, does the organization have a policy and procedure with a formal process where HR notifies IT of staff termination or departures or other reasons to revoke their access? Do you have that or not? Yes or no? Okay. If you have it, we're going to ask for proof. That's that red box on the bottom. Upload your PNP, your policy and procedure. Excuse me. And that information. Because as you build this, again, we're going to centralize everything. We're going to get all the information together so you have not just an SRA that says, yep, I was compliant, but you also have the documentation that shows what you were actually doing at the time. Very helpful if you're, getting checked for 2 years past. All right, sometimes you're not compliant. Okay, you're gonna be like, oh, wait, we don't have that. Okay, click no. But at this point, the system doesn't just move you on. Please don't fix it right now, because again, we're trying to make a deadline. But if you have some notes, like this is what we do, but we don't document it, or here's a policy and procedure we could adopt, but we're not actually following it yet, let's get those notes in here. Upload any documentation. You can see the sample policy in the right, because if you don't have one, we'll provide you a template, okay? It still needs to be completed and tweaked, but we will provide that so you have it as you move through. Not on all questions, but there's several that have this option of not reasonable and appropriate for our circumstances, okay? Don't overuse it, but when appropriate, you can select that when it's allowed on a particular control. But you can see the red box there, you've got to document why. And again, upload anything you're doing as a replacement for it, okay? Let's document that. So maybe you're not complying exactly with what HIPAA says, but in this case, you have a substitution. Make sure you note that, all right? Now, at that point, when everybody's answered all the questions, or however many people you have participating, whether it's 1 or 17, you get all the information in. Now there's a review that's got to happen. Whoever's doing it, you should double check that everything's uploaded, that you've got the right information in. Somebody didn't accidentally upload a picture of their cat, but you got the actual policy and procedure, quick check through, and then you move on to assessment and the planning of the remediation, right? This is where you take the ideas or the controls, rather, that are not in compliance with HIPAA. They're going to go right here on this remediation plan page, and you're going to go right where that blue arrow points to, click that edit icon, and you're going to come in here. The screen pops up, and this is where we talk about the automation. This is all the detail that you need to put in as you're building a plan of what gaps you have to remediate. And as you do it, those first few boxes are completely filled in for you. Okay, the assignee, that's the person who has to fix it and has to deal with the remediation. They're pre-filled in here based on who answered the question. Now, if you want to reassign it to a different person, thumbs up, do that. You can do it right here. If you include their email, they're going to get weekly reminders of what HIPAA remediation tasks they're assigned to. Really helps keep things moving. Not the end all be all. You still may have to make some phone calls, send some emails, walk over to somebody's desk and harass them yourself a little bit, because again, they've got day jobs too. But this helps. Pick a target date. When is this going to get fixed by? If it's a high risk item, let's make that soon. Low risk item, you can take some time. You can focus on those after the high and the medium risk are taken care of. And then the bottom box here, this is critical. This is the action plan that you need to do to become compliant, okay? We give you something there, right? It's generic. It's not meant to be the end all be all, but it is a great starting point that you can then customize. Occasionally it works exactly for your situation, but it could be, hey, we've got the policy, we just need to implement X, or, you know what, we're doing this already. We've got the right encryption level. We need to adopt a policy and procedure that says we're going to stay that way. Okay, you're going to put this in, pretty simple. The link in the upper right, click here for question that spawned this risk. Really cool. This gives you all the notes, any attachments that you or whoever was responding put in when they answered the initial question. You don't have to go ask them. You don't have to say, hey, you referenced an old policy and procedure, but I don't know where it is, it's right there. Really makes it easy to accurately say, this is what we need to do, this is when we can get it done by. All right, really, really helpful. And then you just do that for each risk. Again, if you've got 5 risks, this is going to be really quick. If you got 60, it's going to take a little bit longer because you got to go in for each one and make the plan. But the beautiful thing is it's organized. It's step by step, okay? Once every risk has a plan, you can finalize the report, okay? Do a quick review, make sure you've got everything, double check your work or others, and then you sign it digitally and say, here is my SRA. Now, this is really key because that point where you sign it, that's the December 31st deadline. Note, we haven't fixed a thing yet, and that's okay. The deadline and the requirement for MIPS MACRA, and really the HIPAA security rule itself, is completion of an SRA, a security risk assessment, that involves having that remediation plan and identification of the gaps. That's the key. That's where you've got to get. And then you have time to work on those risks and identify it. And we help you through with that. This page, just really quick, gives you a dashboard that's going to track progress as you go through the beginning of the next year and you're working on it, okay? This is what you've moved, what high-risk items, do you have a bunch left? Have you moved through them? Are we down to just the low-risk items? How many items are we working on each month? Really helps see that, okay? This is how we track. And again, this is post-December 31st, but still absolutely critical for ongoing continuity and compliance. In here, you're going to go in, and each risk that's assigned to whoever in the organization, they're going to log in, they're going to take a look at it, and they're going to get to work, all right? You can, if situation changes, if somebody moves, somebody new joins the organization, et cetera, you can change the assignee, you can even change the target date, et cetera, okay? But you document in here that you are getting things done. You can upload the new policy and procedures. If you click on the risk number 2 at the very top there, that brings back that context again, just like we had in remediation planning. Whoever you assign this to doesn't have to go look for another email with the old documentation. They don't have to go look for any notes about what needs to be done. In there, you've got all that. You can download any information that was uploaded earlier and bring that right out. You can reference it. You can have that at your fingertips. And again, there's another link for this, whoever the assignee is here, the worker on this, to download that policy and procedure. So you didn't even have to grab that while you're going through the assessment. You can grab the specific policy and procedure that's needed and move through that, okay? And then, of course, the report. I mentioned that earlier, right? You've got to have a report. So that's generated here as well. It's got all the detail that you want, okay? It's got the scope, the definitions, the methodology, all that stuff that really we don't generally care about putting in too much. But if you're audited, you need that. You need that key information so that they know you conducted a thorough HIPAA security risk assessment. Absolutely critical, okay? Now, that's the process, right? You can see how the HIPAA 1 software really moves you through, makes it easy, makes it bite-sized, absolutely critical. But here's what's cool. This is the time that's going to be required, right? When you assign out that HR role, they're going to need about 30 minutes usually is what we see to get you the information. IT guy is going to need a little more time. Facilities, security officer, or if you're doing it all yourself, you might want to add all that together, give yourself a little bit of extra time. But you can see it really helps make the organization more efficient. Get this done. And then the HIPAA security officer, whoever's running the assessment, is going to need a little more time to do the planning, to build that plan in there, to finalize the review. Typically what we see, 5 to 10 hours, you're definitely done. Okay, and I know that's a wide range when you think about it, but you do need to take some time to do this, okay, and get it done right. Now, I say take time, but we have had folks call us up on December 31st in past years and say, oops, I haven't started yet. And they can get it done. Is it the prettiest risk assessment in the world? Nope. Do they have a whole lot of remediation to do, generally speaking? Yeah, definitely do have some work to do in the new year, but they can make the deadline with this. Not the recommended approach, but it will qualify and meets the requirements there at the end, okay, for that MIPS and MACRA qualification. So with HIPAA 1 and our platform here at Enterprise Health, we have two methodologies that we work with folks at. The guided assessment, you're working through the software that I just showed you, and it guides you right through the workflow in the system itself. You'll have the policies and procedures. You have everything you need. Tons of help videos. If you have a question, you can choose a quick email to support. We'll get back to you quick. And other times a year, we also can do a validated assessment, which means we're going to review, right? We're going to go through your responses. We'll do that final check of what is actually HIPAA compliant and what's not. Again, we've got great HIPAA experts. This is what they do. If there aren't any other questions, we'll let everybody get back to everything else on your plate besides HIPAA. But love to chat with you. Call us, email us anytime. Thank you so much for coming. Appreciate you joining us today.